Brought to you by wikivd.com. MDMA. 3,4-methylene-deoxymethamphetamine, commonly known as ecstasy, is a psychoactive drug used primarily as a recreational drug. Desired effects include increased empathy, euphoria, and heightened sensations. When taken by mouth, effects begin after 30-45 minutes and last 3-6 hours. It is also sometimes snorted or smoked. MDMA has no accepted medical uses. Adverse effects of MDMA use include addiction, memory problems, paranoia, difficulty sleeping, teeth grinding, blurred vision, sweating, and a rapid heartbeat. Use may also lead to depression and fatigue. Deaths have been reported due to increased body temperature and dehydration. MDMA increases the release and slows the reuptake of the neurotransmitters serotonin, dopamine, and norepinephrine in parts of the brain. It has stimulant and psychedelic effects. The initial increase is followed by a short-term decrease in the neurotransmitters. MDMA belongs to the substituted methylene-deoxyphenethylamine and substituted amphetamine classes of drugs. MDMA was first made in 1912. It was used to improve psychotherapy beginning in the 1970s, and became popular as a street drug in the 1980s. MDMA is commonly associated with dance parties, raves, and electronic dance music. It is often sold mixed with other substances such as ephedrine, amphetamine, and methamphetamine. In 2014, between 9 and 29 million people between the ages of 15 and 64 used ecstasy. This was broadly similar to the percentage of people who use cocaine, amphetamines, and opioids, but fewer than for cannabis. In the United States, about 0.9 million people used ecstasy in 2010. MDMA is generally illegal in most countries. Limited exceptions are sometimes made for research. Researchers are investigating whether a few low doses of MDMA may assist in treating severe, treatment-resistant post-traumatic stress disorder. In November 2016, Phase 3 clinical trials for PTSD were approved by the United States Food and Drug Administration to assess effectiveness and safety. Medical. MDMA has no accepted medical indications. Before it was widely banned, its sole limited use in therapy. Recreational. MDMA is often considered the drug of choice within the rave culture and is also used at clubs, festivals and house parties. In the rave environment, the sensory effects from the music and lighting are often highly synergistic with the drug. The psychedelic amphetamine quality of MDMA offers multiple reasons for its appeal to users in the rave setting. Some users enjoy the feeling of mass communion from the inhibition-reducing effects of the drug, while others use it as party fuel because of the drug's stimulatory effects. MDMA is used less frequently than other stimulants, typically less than once per week. MDMA is sometimes taken in conjunction with other psychoactive drugs, such as LSD, psilocybin mushrooms, and ketamine. Users sometimes use mentholated products while taking MDMA for its cooling sensation. Forms. MDMA has become widely known as ecstasy, usually referring to its tablet form, although this term may also include the presence of possible adulterants or dilutants. The UK term Mandy and the US term Molly colloquially refer to MDMA in a crystalline powder form that is thought to be free of adulterants. MDMA is also sold in the form of the hydrochloride salt, either as loose crystals or in gel caps, in part due to the global supply shortage of sassafras oil. Substances that are sold as Molly frequently contain no MDMA and instead contain methylone, ethylone, MDPV, mephedrone, or any other of the group of compounds commonly known as bath salts. Powdered MDMA is typically 30–40% pure due to bulking agents that are added to dilute the drug and increase profits, and binding agents. Tablets sold as ecstasy sometimes contain 3,4-methylenedioxyamphetamine, 3,4-methylenedioxyethylamphetamine, other amphetamine derivatives, caffeine, opiates, or painkillers. Some tablets contain little or no MDMA. The proportion of seized ecstasy tablets with MDMA-like impurities has varied annually and by country. The average content of MDMA in a preparation is 70 to 120 mg, with the purity having increased since the 1990s. Short-term. The most serious short-term physical health risks of MDMA are hypothermia and dehydration. Cases of life-threatening or fatal hyponatremia have developed in MDMA users attempting to prevent dehydration by consuming excessive amounts of water without replenishing electrolytes. The immediate adverse effects of MDMA use can include the adverse effects that last up to a week following cessation of moderate MDMA use include long-term. The long-term effects of MDMA on human brain structure and function have not been fully determined. However, there is consistent evidence of structural and functional deficits in MDMA users with a high lifetime exposure. In contrast, there is no evidence of structural or functional changes in MDMA users, with only a moderate approximately 60% of MDMA users experience withdrawal symptoms when they were stopped taking MDMA. Some of these symptoms include fatigue, loss of appetite, depression, and trouble concentrating. Tolerance to some of the desired and adverse effects of MDMA is expected to occur with consistent MDMA use. A 2007 analysis estimated MDMA to have a psychological dependence and physical dependence potential roughly 3/4 and 4/5 that of cannabis. MDMA has been shown to induce delta FOSB in the nucleus accumbens. Because MDMA releases dopamine in the striatum, the mechanisms by which it induces delta FOSB in the nucleus accumbens are analogous to other dopaminergic psychostimulants. Therefore, chronic use of MDMA at high doses can result in altered brain structure and drug addiction, which occur as a consequence of delta FOSB overexpression in the nucleus accumbens. MDMA is less addictive than other stimulants such as methamphetamine and cocaine. Compared with amphetamine, MDMA and its metabolite MDA are less reinforcing. One study found approximately 15% of chronic MDMA users met the DSM-IV diagnostic criteria for substance dependence. However, there is little evidence for a specific diagnosable MDMA dependence syndrome. Because MDMA is typically used relatively infrequently, there are currently no medications to treat MDMA addiction. Thank you for watching. Brought to you by wikivd.com. Please like and subscribe below. Please like and subscribe below.